Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Hello everyone, it's Brigid Maloney.
Welcome back everybody. I'm obstetrician Dr. Patrick Maloney.
And this is the Kick Pregnancy Podcast. And we're so happy to have you here. This is a question, Pat, that we've been asked a lot. And it is, should I have a vaginal birth or a caesarean section?
Okay.
So what we're going to talk about is why someone would ask that question.
Yep.
And then we're going to go through, this person actually asked for the pros and cons of both.
Yeah, that's a good way of approaching it. Did they mean like for their first baby or for their second or subsequent baby after a previous Caesar?
Look, it wasn't clear.
Okay.
So actually that's a good point. If everybody, when you send your questions, we love your background.
Give us some info.
Yeah.
Because the answer might be a little different.
Yes,
yeah.
But let's just assume that people might be listening to this that it is their first birth or it's a subsequent birth. We'll talk about both scenarios.
Good.
All right, so I want to start with, Pat, why do you think people ask this question in the first place?
I think some people pregnant with their first baby are just aware that there's 2 ways for that baby to come out and might be just interested in hearing the pros and cons of each approach. And most people have heard of some people... to most people, a vaginal birth is the default position and the Caesar is what you do if something's wrong. But some people have definitely heard of people who would choose to have a caesarean section with no medical indication, right? I just want that. That's my preferred way of having the baby. And it's not because I've got twins or placenta previa or whatever. It's just what I want. So then there are also the people who might have some specific medical reason to want to have a caesarean section and might be interested in exploring that. And some of those people, like maybe they've had a previous caesarean section and they're exploring the benefits of planned section for the second baby versus VBAC. Or in that first birth it was traumatic, physically, emotionally. There's some people with something called tocophobia, which is a fancy way of saying fear of labour. Yep. So they're just super afraid of labouring.
We've actually had that question a lot, whether we can do a separate podcast on tocophobia.
Yeah. I think we should, and I think we can, but I think the best thing would be, so we're not just pooling our lack of knowledge on it, I think we should do that as a podcast with a mental health professional who can, the sort of person we might send somebody to discuss those fears, work out where they might be coming from and see whether they can be addressed through therapy rather than just doing a Caesar.
Yep.
A common one is fear of tearing. That's really common. Fear of the loss of sexual function or of sexual identity through changes to the genitals that might come about through childbirth. These are the things we hear about and see.
Yeah. And you did mention at the start, it really depends on whether it's their first or their second birth.
Yep.
And I know we do talk about the second birth and generally that they go much better.
Yeah.
And somebody who's had a first traumatic birth, their thoughts might turn to a planned caesarean. And I don't know what we can do to help them understand or feel better that perhaps their second birth will be different from their first.
Well, we can give it a go. That's what we should do. So let's take a few different potential scenarios. Let's, for example, look at somebody who had a baby that was bigger than expected and they got a 3rd-degree tear. And the 3rd-degree tear required repair and physiotherapy. There's some evidence that the anal sphincter might only have one good tear in it, okay, and that if it's been significantly torn and repaired expertly to the point where the anorectal function is normal, that we shouldn't mess with that again and risk a second tear from a second vaginal birth. And a lot of people in that situation would elect for would plan for a planned section for second baby. And I think that's got some validity. If we look at the less significant tears, well, firstly, they can be expertly repaired. they don't lead to long-term dysfunction, and they probably won't happen with the second birth. Everything's more stretchy. Does that make sense?
Yeah.
So talking to people about the facts, and in particular about the very many important ways that the second vaginal birth is different from the first. It's faster, it's more efficient, it's less painful overall because the painful part of the labour is shorter. The pushing phase is way shorter because the tissue around the vagina is more stretchy. So you don't run out of puff, so instrumental births are way less common. And a lot of the significant perineal trauma is related to instrumental births.
Yeah, I read even for forceps it goes down from like 8% down to 0.7% in second births.
Absolutely.
Yeah.
Yeah, so you just don't get those obstructions at full dilatation that need those significant interventions. If you look even in my practice, I don't mind saying, first baby epidural rate, 50%. Second and subsequent, 5%.
Yeah, wow. Yeah.
That's the difference. That's how massively different it is. So we have to be careful that we're not comparing apples, that we are comparing apples with apples, and we're not making the mistake of thinking it's going to be the same again. Yeah.
And someone it's their first birth and they're thinking about whether they should have a vaginal or a caesarean birth, and they're doing all their listening and research and all the rest, and they hear about all the things people put in place and got the dream vaginal delivery. Often those people are talking about their second births.
Oh, of course they are.
Yeah.
On the socials in particular.
Yeah.
So I think one of the more frustrating things that we sometimes read on the socials is, I had a complex and difficult and somewhat traumatic first birth. So I got rid of this, changed that, changed the other, and the second birth went fine. When of course we know it was always very likely to go fine no matter what you did.
Yeah. This is a really tricky question. If someone's coming into their birth, either first or subsequent birth, and they've got all these fears around vaginal birth and they're thinking, okay, so should I have a vaginal birth or a caesarean section? How can we support them, do you feel?
I think that there's something we can do even before then. Pregnant people are going to find enough scary stuff on their own. And as their friends and family, we don't need to talk to them all the time about poor outcomes. So I think if you know somebody who is pregnant and you're thinking of sharing the story of a poor outcome that's not otherwise relevant to that person.
Zip it?
Potentially zip it, yeah. Well, at least stop and think, why am I sharing this? Is it necessary for me to share this? And have I really thought about the downside of sharing this?
And am I sharing it because I haven't healed from my own trauma?
Correct.
Yeah,
absolutely. So we don't want to scare people, and they're going to find, if they want to read about poor outcomes, they're going to find that themselves. They don't need you to tell them that. And the fact that you are telling them that, and a bunch of other people are telling them that, may just be leading to a confirmation bias in their mind that it's more dangerous than it looks. Yeah.
And what about at a practitioner level? So I think people have probably guessed we're pro-choice in terms of a woman's birthing rights. But there's people tell us all the time that they've been felt pushed in one way or the other from one of their health practitioners. It's very difficult as a person. You can't change that other person's behaviour. Like, you can't change that practitioner's behaviour. So it's about how you receive their information. Yeah. So if you've gone, okay, well, I'm going to have a planned caesarean, and you're getting pushback from your healthcare practitioner, what do you think somebody should think or do there?
It's interesting. I think it's the job of the healthcare service, the hospital, the obstetrician, to make sure people are well informed about their choices. But ultimately, with this one, I believe it's ultimately up to the woman. For example, and this is not available everywhere. Not every institution offers this choice. But in my practice, if someone says that they want a planned section without a medical reason per se behind that decision, I'm very keen to explore why. Yeah. And I've sent a few people, not that many people want this off the bat. Not many people say that this is how I want to have my first baby. But the ones that do, I'm very keen to hear why. And a few people I've sent for discussion with a clinical psychologist or other mental health worker comfortable with the pregnancy space. Not because I think that person has a mental health problem, but because I think that their concerns need airing, so that ultimately we can work out that maybe the fears are unfounded, or maybe the fears are actually to do with something else. So if the fear really turns out to be a fear of being a parent, or a fear of being a bad parent, or something like that, then those things might be addressed in better ways than changing the birth plan.
Yeah, or a fear of something that they've heard about birth.
Yes.
You know, like a fear of getting a needle or whatever it is.
Exactly. Yeah. So some of these things, there are workarounds to some of these things, but ultimately, if someone says, "I've heard your evidence, thank you
very much,
thank you, I would like the caesarean section," then in my practice, the answer is yes.
Yeah. Yep. And also, I suppose, does it ever go the flip side? So you might recommend a caesarean section, and someone's like, no.
This is probably more common.
This is more common, plus also really hard, I would imagine.
It is hard, and one of the things that I've found useful in previous episode, we talked about the maternal assisted caesarean section. I've found maternal assisted sections to be a really great way of a compromise for somebody who understands that they should have a section if they're just looking at risks and benefits. But man, they don't want one.
Yeah.
Yeah, and they're upset and they're disappointed and they're ripped off. Then saying, well, it could be a maternal assist, that has helped a few people get over the line to ultimately make what was a better decision to have a Caesar.
It's funny, the question that came from a listener was to explain the pros and cons of natural birth and caesarean section. And I feel that natural birth means no intervention.
Well, yeah, that's why we prefer to use the term vaginal birth, don't we? Because the natural to some people means no drugs. It also sometimes carries an unfortunate connotation of being superior.
So I think if we're going to go on and do the pros and cons of vaginal and caesarean birth, we're not doing natural birth. I think if we ever were to do that, that would be comparing natural birth and vaginal birth.
Yes, we're talking about the real world common practice pros and cons.
Yeah, because, was it this episode where you said about 50% of your first timers would have an epidural, but then 5% of your second timers. So, yeah, natural, we could do that, natural versus an epidural birth, for example, if that ever came to pass. If anybody wanted to hear that, just tell us.
As in a separate episode.
Yeah.
Fine, good. Yeah, good. So let's return to vaginal birth and the things that are said to be better about it.
The pros. Can I say, before we do pros and cons, that's still sort of brain work, isn't it?
Yeah.
It's all making decisions. It's very cerebral. And sometimes this is a gut feel too, so you've got to go with your gut feel.
Yeah. And for most people, the gut feeling at the start is a preference for vaginal birth. For most.
Yeah.
Not all. But if we're talking about the headspace, pros and cons, what are the risks and benefits? Vaginal birth in general across the globe with all different levels of medical systems and supports and safety of surgery and so forth, it's probably the safest way to have a baby for most people. It's good for subsequent pregnancies. You have vaginal birth for your first, you're going to go super well for as many more as you want. And that's not an optimistic. That's not being excessively optimistic. That's just broadly true. That the second and subsequent births will go very well.
Like that Russian lady that had 69 babies. Maybe not that many.
What have you been reading?
Very old, like in the 1900s.
There's less risks of infection.
Surgical.
You're not going to get a surgical wound infection from a vaginal birth. You can get an infected perineum, but that's not common. Yeah.
What, from a tear or something?
Yeah, exactly. We thought we'd discuss the potential benefits from lactation on lactation on vaginal birth. Certainly there's some evidence that lactation starts a bit sooner. It's not much sooner. and there isn't really any evidence that that slight delay matters.
And maybe if there is a delay, is it because some caesarean babies need to go to the nursery or something like that?
Yeah, for sure. They might be in a crib in the nursery for the reason that the caesarean section was done in the first place. So these are called confounders. It appears to be one thing or another, but the problem is in the Caesar group and the vaginal birth group, you might not be comparing apples with apples.
And I wonder whether it's a bit of a layover from earlier days where caesareans were thought of as more surgical and like the baby wasn't put on mum's chest.
Absolutely, because you used to have to be way sicker to need a Caesar. They were rarer. Last resort.
Yeah.
So I'm not surprised if back in the day the breastfeeding rates from Caesar births were really poor because mum and baby may have been really sick. A better comparison would be well woman having planned section versus well woman having vaginal birth. Yeah.
Well, this well woman having a planned section, baby straight on breast, feeding 10 minutes after the Caesar? Yeah.
So
not sure milk was coming out. Just a little bit of colostrum.
Want to feel good more often in 2026? Hi, we're here for you. Move by Mamma Mia helps you fit movement into your everyday, giving you more of me time whenever you need it. From strength and cardio to yoga and Pilates, with workout plans that fit every space, every body, and whether you've got 10 minutes or 40. Start 2026 with enjoyable movement from just $9.99 a month. Mamma Mia subscribers get unlimited access. Head to move.mamamia.com.au and use MoveMe to get $20 off an annual subscription.
recovery. In most cases, an uncomplicated vaginal birth is going to have a better recovery. For the Caesar, in the initial phases, you've still got the spinal anaesthetic and you can't even move for 6 hours, and then by now it's night time and you're likely to keep the catheter overnight, so you're probably not going to get up and have the catheter out and move up and go to the toilet till the next morning. And then you've got a surgical incision, which hurts. The vaginal birth cohorts are going to be a lot more mobile, especially in that first day, and have less pain related to movement in the coming days.
Yeah, but still a swollen perineum. And
absolutely. Yeah. So this is where the complexity comes in. If you're unlucky and get a big perineal hematoma, that's way worse than a caesarean section incision.
I don't know what that is. What is that?
Like a giant bruise around the vaginal opening.
Yeah, right.
Way worse than a Caesar cut, so it's not always true.
And how often do they happen?
Oh, well, that's really rare, but that's what I'm saying. A vaginal birth that goes well has a better recovery than a Caesar, but a vaginal birth that goes poorly does not. Yeah.
These are the unknowns, and I think this is why these questions get asked. Should I have a vaginal birth or a caesarean? Because
but the answers aren't easy.
No.
Right? Yeah.
Also, it's said that there is a better birth satisfaction with a vaginal birth. But again, only if it goes well.
Well, I think if it goes well, there's a certain confirmation that my body has worked in the way that it was supposed to, or was designed to, or I always thought it would.
I was built for birth.
Built for, and that would be satisfying, and that's important to some people and not to everybody. Other things that we look at is economic issues. So, vaginal birth. Go home a bit faster, which in terms of our health resources is good. And the Caesar's expensive. It's an operation, operating theatre, tons of staff, lots of people.
We talked in a previous Myth or Fat, though, not expensive because the obstetrician gets paid more.
No, it doesn't change what I get paid, but it changed what the overall thing costs. Yeah. For sure.
Yeah, every night in our hospital, our public hospital, is $1,000, and in the private hospital, I think it's something like $1,200 a night.
Sure, but and that's just the cost to the patient of being in the bed. There's cost to the cost to the patient or the patient's health fund, but the cost to the community of running a caesarean section,
the whole theatre,
many thousands. Yeah. Whereas the vaginal birth might happen with you and a midwife in a room, and could be very, very minimal costs.
Yeah. And what about the respiratory conditions for the babies? Like the vaginal birth is, you've said it before, that the baby gets squeezed as they move out the birth canal.
Yeah. There might be in general, less of a condition called TTN, or transient tachypnea of the newborn. So a baby that's got a temporarily high respiratory rate due to fluid in the lungs, and there's less at that, give or take, at vaginal births than there are at caesarean sections. That's normally expertly managed by the paediatricians, and it's one of the reasons why there is always a paediatrician at a caesarean section, but not always a paediatrician at a vaginal birth. So that's a reason. Yeah.
Any more pros? I'm sure we've missed some. Tell us, if you think we've missed a pro of having a vaginal birth, we want to know.
We do want to know.
You want to move on to the cons?
Yes. It hurts.
It does, yes. But there is pain medication to help.
Yeah. And epidurals and TENS machines and everything, but it hurts.
And it can be, for first-time mums, I think it's still not wide enough known that it takes a long time. They could be actually in the thick of active labour for a long time.
Yeah, so it's not only painful, but the pain can go on and on, especially that first birth. There are some unpredictable things in vaginal births that people find, that can happen in the blink of an eye. Things like tearing to the perineum, postpartum hemorrhage, whereas by comparison, the caesarean section environment is controlled. Occasionally, we'll get a baby out at caesarean section, and the head causes a slightly bigger tear in the uterus than the hole we'd made. But that's a couple of extra stitches on our way out. That's not like a bad perineal tear. So those risks, you can get a postpartum hemorrhage at a caesarean section, just way less common.
Yeah, right.
Some of the rare complications of vaginal childbirth, like retained placenta, doesn't really apply to caesarean section, because if the placenta's taken too long to come out, we just reach it in and pull it out. Yeah,
you can see it.
And you can see it. Yeah. The uterus is open right in front of you.
It's also, I think when people are thinking about vaginal birth versus caesarean, I think they really are talking about their perineum. They're talking about controlling the situation by knowing when they're going to go into labour.
Yep.
And I think they're talking about how their pelvic floor is going to function after.
Yeah, so I think the long-term risk of prolapse and incontinence is probably the big ticket item. And not even this is easy to analyse. A lot of the research points to the fact that being pregnant is a risk to your pelvic floor tone and your continence. And it's not all about how the baby gets out.
I found a Canadian study, and in the non-pregnant population, 10% of people had urinary incontinence.
Yep, 10%. Yep,
10%. Vaginal birth, 21%. And C-section, 15.9%.
Yeah.
So pregnancy is a risk factor.
So half the increased risk happened anyway, even if you had a section. Yeah. So that's really interesting. There's no doubt that there are certain types of vaginal birth that significantly predispose a woman to surgically relevant prolapse later in life. Labours that take way too long. OP labours where the baby comes out looking at the ceiling instead of down at the floor. Forceps deliveries, and particularly rotational forceps deliveries.
Which aren't done that much now, are they?
Not by me.
No.
There's sometimes, but not by me. It's my firm belief that the risks of that are firmly out. They firmly outweigh the benefits.
They seem to be, what's happening right then with the birth, and not really considering.
You're forgetting about 20 years later.
Yeah, that's where I feel like you've got to be careful what you wish for if you want a vaginal birth at all costs.
Yes, and this is one of the reasons why we look for continuity in our obstetric care, which is easy to get in the private sector and harder to get in the public sector. But one of the things that sort of continuity allows you to do is to turn to a trusted advisor in the thick of battle in labour when things aren't going well, and saying, all right, I understand my choices. What do you think I should do? Because that's somebody you didn't just meet 3 hours ago.
Yeah. And this is the thing, like, you know, I know we're doing the pros and the cons, and that makes it so sort of black and white. I think what we're trying to say is it's very muddied.
Yeah.
We think that if any of the cons have given you heart palpitations and you've gone, for sure, I'm not having a vaginal birth, I'm going straight for a caesarean section, what we suggest you do is go back and listen to the assisted birth podcast that we did, the caesarean section podcast, because what we've heard from our listeners is that they've gone through their whole labour and vaginal birth, and yes, they may have had an induction, a failed epidural, forceps delivery, and then a Caesar at full dilatation or whatever. But the whole way along, they knew how to handle that, how to ask the right questions, what was coming next.
Yeah, they knew what those things were.
Yeah.
And that those things existed. This is what we think is the value of knowing more stuff.
So that those big cons to having a vaginal birth might diminish a little. Yeah.
Absolutely. And there are some people who are scared of information and want to take a head in the sand approach to childbirth, but I think most people benefit from knowing a lot more than they otherwise would have.
Yeah, they get to ask the right questions to begin with.
Absolutely.
Good. We're talking about vaginal birth or caesarean birth. And now we're going ahead, Pat, aren't we, and talking about the pros and cons of caesarean birth.
Good.
What do you think the pros are?
Look, there are some obstetric situations where it's definitely safer to have a Caesar. Better outcomes from a Caesar. So some of them are no-brainers. Triplets or above.
Oh.
3 or more babies in there. You want a section. Some twins are definitely safer with Caesar. Some twin situations can be equally safely delivered vaginally. A placenta previa. If the placenta is covering the opening, right across the opening, then you must have a Caesar.
I don't even know. How did they do that before Caesars were even a thing?
Oh, the outcomes were very poor.
Yeah.
Yeah.
And they wouldn't have even have known that there was a placenta previa. That person would have just laboured and laboured.
Well, yes. And so if you look back to the pre-medical success rates, that's what, these conditions that are now just routinely avoided by caesarean section, like a ruptured placenta previa, those women didn't survive their pregnancy, and it used to be really dangerous. So that's not, these ones are relative no-brainers.
Yeah.
Okay. There are some infections. Herpes infection is the most commonly encountered one, where it's bad for the baby to come out through the vagina and get the herpes virus on them as a newborn. This
is herpes in your genitals.
Yeah. If you've got an active infection at the time of labour.
Oh, rightio. What's an active?
Well, it's not just like you were exposed 20 years ago and the virus is living inside you somewhere. You have to actually have a herpes sore on the genitals at the time. And
would a woman know she's got a...
Yeah, it's super painful.
Oh, okay.
Yeah, so you if you knew that, you'd bring it to the attention of your caregivers, and they would recommend caesarean section.
How common do you see herpes in labour or in pregnancy?
Oh, I see it several times a year in pregnant people. It's a recurrent. It can be a recurrent infection in some people, and then once every few years, we said present that term, complicating the situation and leading to a Caesar done for that reason.
Yeah.
Yeah.
What a bummer.
Well, yeah, that is a bummer for people. Yeah. Although if you are prone to frequent recurrences, you can go on suppressive therapy.
Even when you're pregnant?
Yeah.
Right.
And if you're just on the suppressive therapy, you won't get the outbreak at term, and then you don't need the Caesar.
Yeah.
As we've covered before, section is associated with not a zero risk of incontinence and prolapse, but less risk than vaginal birth. And of course, there are some reasons. There are some non-obstetric reasons, like if you've got a bad heart valve, it's okay. Your heart works fine if you're just walking around, but it may not work fine if you're pushing for 3 hours in labour.
Yeah, right.
That's the sort of exertion that your heart valve might not be able to handle, and some people with known heart issues might be recommended not to push, and therefore they might have the sort of labour where they have a a planned instrumental or just a Caesar.
Yeah, right.
Yeah.
Gosh, can you do a planned instrumental? That person would have already... Oh, it's just the pushing. It's not the actual contractions during labour that would push a heart valve.
Yes. Let's say someone was going to have a vaginal birth but had was thought to react very poorly to a painful labour. You could put an epidural at the start, labour up painlessly, get to fully, and then have a forceps without pushing.
Yeah, wow.
Yeah. Certainly done that a few times.
Because a person's preference?
Because they had heart disease.
No. Like, why wouldn't they choose a caesarean in that situation?
Oh, well, Caesar might have its own risks for them, and if they preferred a vaginal birth and just wanted it done safely, then that's how you do it.
There's this also, we've talked about it previously. It's a con might be for some people who perhaps, have got to the point where they need to plan it. For their own mental health, they need to have the unknowns removed.
Yes. Yep. And we certainly see that. And that is a real mental health issue for some people. This is not just, type A's and the people we like to make jokes about. This is the lack of confidence that it will go well or that it will happen on time or that they'll get to the hospital is a real source of anxiety and fear for some people.
And we've mentioned it before, but that term tocophobia, someone's got a big fear.
Yep.
Is it likely that they would go on and have a caesarean?
Well, potentially, yes. Although, let's say my fear is that I won't make it to the hospital. Well, you don't necessarily have to do a Caesar. You could do an induction. You could just come in at term and be induced. But if the pain is labouring, if the essence of the fear is labour and vaginal childbirth itself, then the various psychological interventions during the pregnancy haven't been successful or weren't pursued, then fine, you can have a Caesar.
Yeah. All right, so let's move on to the cons of having a caesarean birth then, because there are a few.
There are, and this needs to be taken into consideration in the big, beautiful discussion about how this is going to happen between an individual woman and her care providers.
Yeah.
The caesarean section itself, if done to avoid trauma to the pelvic floor, might cause its own trauma. Okay, so surgical complications can happen. An emergency caesarean section done with lights and sirens can be just scary and traumatic emotionally for people. The point I'm trying to make is that it's not necessarily the easy way out. Okay, childbirth, whichever way the baby comes out, is going to be a big deal.
Yeah, big deal. I just think, that we could get, if we were able in our common language to get rid of some things in terms of pregnancy, then it would help a lot of women that feel guilt about how their baby was born to be, just not there.
Yeah.
So things like, you took the easy option or your body failed you somehow or whatever. I think that would be good if we just stopped thinking about it. Both vaginal birth and caesarean birth have their equal.
Yes, I think those judgmental comments are particularly unhelpful, and that's why I try and confine the discussion to sort of proven pros and cons, and no value judgments about the decision that's ultimately made.
Yeah.
So, there's no doubt for a Caesar you stay in the hospital a bit longer.
I like that.
Well, yes and no.
I see that as a con.
Yeah, well, that's right. And it's not for everybody, but it is a factor for health economics.
Yeah. I know sometimes you do encourage people who have got good support systems to go home. So I'm not saying, that everybody likes staying in hospital, but I was just avoiding the kids.
Well, that's true. That's a thing. So I think that we've got to be careful comparing apples with apples, because if you are a pretty healthy person and it's not your first baby, and you're well supported at home, and your bladder and bowels have started working again, go home. If you really think that's right, what's right for you, and you're well supported, go home. Yeah,
you don't sleep very well in hospital. No. That's for sure.
These are the people I say. My usual line is the hospital's for working at. It's not for being a patient in. If you're better off at home, you don't have to stay longer with a Caesar, but in general terms, the length of stay is a bit longer.
Yeah. They also, a con is that they say that the recovery is longer.
Yep.
I want to say, is that still the case?
I think it roughly is the case. If you ask someone at 3 or 4 weeks after a seizure, does your scar hurt? They might say yes. But if you ask a better question, which is the pain from your scar limiting your daily activities, they'll probably say no. So, yeah, I guess the recovery is a bit longer, but is it meaningfully longer? Perhaps not.
And, you should be recovering and doing less. You should be looking after your baby.
Yep.
And perhaps that's the case if you've had a vaginal or a caesarean birth. People rush around and think, I'm back at it. I'm like, why?
I reckon if we're talking about recovery, everyone needs a friend who's had one of each. That's a person I'd take who I would take notice from.
Yeah.
Otherwise, everybody else only knows their own experience.
Yeah.
The cons of section really become more important when we look at the pregnancy after that and the pregnancy after that. And there are some risks involved in the next time you're pregnant in having a vaginal birth when you've got a scar on the uterus from the previous Caesar, and that's the risks of VBAC. And then there's the risk if you don't have a VBAC and you've had 2 Caesars, now you're kind of stuck with Caesars for the rest of your obstetric years.
Yeah,
that has a risk, but not until you get to about 4 or 5.
Yeah,
they become a little more surgically complex at those sort of numbers. But most people having 2 or 3 babies, and at those numbers, the risks aren't really important.
Yeah, and it's not to say that if you need 4 or 5 caesareans that they can't be done. Like, there is a bit of a myth saying that you can only have a certain amount of caesareans.
No, you can have as many as you want.
Yeah.
It's just they get a little bit harder to do and the risks go up.
Yeah.
There's one very significant risk that if you get a placenta previa that covers the opening of the cervix and extends up the front wall of the uterus such that it covers the scar from previous caesarean sections, then it's much more likely to be attached abnormally, so-called placenta accreta. And the risk of the placenta previa being an accreta goes up dramatically the more previous Caesars you've had. And that's probably the most compelling argument in favour of keeping our caesarean section rate reasonably under control, is that this is a seriously complicated, seriously dangerous diagnosis. And there's no doubt that in the future, if the number of Caesars keeps on creeping up, then that's going to stop being a once a year diagnosis in a unit like mine and become a once a month diagnosis in a unit like mine.
Yeah. But what about if people, like, the birth rate is declining, or per woman is declining, isn't it? So, there's not tons of people having 4 or 5 babies.
Well, this is true. Yeah.
We're the only ones that had 4. Crazy people. No, we're not crazy. Gorgeous boys.
Quick question. Are you tired of the news? Do you want a podcast that isn't self-improvement? Come get Unleashed. It's funny.
I also think that underwear is sort of almost like a new marriage. Like, it starts off, it gives you the best of what it offers at the beginning.
It's unhinged.
I have a bit of a thing for my friend's husband's salami.
Oh, hello.
It's not here to teach you anything.
I need to make sure he looks at me. One side, I'm going to make a sign. This is what I married because I didn't meet you in time.
Yeah, right.
The other side, with pointing to my son who's 12. Look what we could have had, Lewis.
Yeah, I love it.
It's a good time for Gen X. So search Unleashed wherever you get your podcasts. New episodes every Tuesday.
Speaking of newborns, there is a bit of an extra challenge to look after newborns. So,
a higher nursery admission rate and paediatric attendance. Yeah.
And for the mother, like, it's physically difficult in the first couple of days to actually pick up the baby, to manoeuvre around the baby. Like, breastfeeding is sort of, you're managing where you're positioning the baby and your caesarean scar. Those sort of things, probably people who have had a vaginal birth don't have those things. So that's I think, a con.
Sure.
And some people might point to that as to how that mum is actually bonding with that baby, or how breastfeeding started.
Yep. So theoretically, yes, but those type of things might be in a list of, known cons, but not deal breakers.
Not deal breakers, that's right. And as we sort of talked about already, I think the idea of starting breastfeeding for someone that's had a cesarean, because there are more and more cesareans, I think that's moving. People are starting breastfeeding and thinking, well, you know, this woman who's had a cesarean should be given the best chance to start her breastfeeding journey.
Let's try hard to keep her more supported, put the baby on the breast more often, do everything we can to maximise supply. Yeah.
And there's a bit of research between caesarean sections and respiratory issues like asthma. Yeah,
this is an interesting one, isn't it? And I think that this is still in the maybe.
Yeah,
it might be relevant. Research is published from time to time where outcome X is divided into people who are born by vaginal birth and people who are born by caesarean section. And sometimes they illustrate a difference, say, in the rate of asthma among 10-year-olds, but they're not able to illustrate why that, you know, what's called a mechanism of action. Why did that happen? And, you know, we're always getting a little bit suspicious if someone says, well, there seems to be a difference, but they can't for the life of them explain why that difference would be there.
Well, they're not taking in those confounders that you talk about? Or
well, if you just don't know why the difference is there, then it's a little unsatisfying, isn't it?
Yeah.
And it's a bit hard to think that might change our mind about anything. If they've noticed a difference and it appears to be statistically significant, but goodness knows why the difference is there.
Yeah.
Some people think that a baby born by caesarean section doesn't come out through the vagina, and the baby doesn't come out covered in maternal vaginal bacteria, and the baby's gut doesn't colonise with maternal vaginal bacteria, and that's important for long-term health. But watch this space.
Yeah. That's called vaginal seeding, isn't it? When someone uses secretions in their vagina and rubs it through the baby's mouth.
Yeah, you can do that, but no proven benefit at this stage.
Yeah, and isn't the thought that the baby gets those good flora and fauna, flora when the baby's put on the mum's chest?
Just from being on you anyway.
Yeah.
Exactly. We're all covered in germs. And the baby's going to get that. In my view, the baby's going to get those anyway.
Yeah.
I don't think you have to come out through the vagina to get those.
Yeah. The other one that I wanted to point out was that there was a study that showed the higher risk of developing type 2 diabetes for babies born by caesarean delivery.
They always try and control these studies for obvious confounders. So, for example, the Caesar group, some of those women would have had diabetes. So, of course, their offspring are more likely to get diabetes. Some of those women would have been obese. One of the major risk factors in Australia in 2023 for an emergency caesarean section is obesity. It makes sense that the offspring of a group that had more obesity would have more diabetes. So there's an awful lot of confounders there, other explanations that could explain the difference other than the way in which the babies came out. And the people doing good studies try and control for that. It's hard.
I think, thinking about your newborn and the effect that your decision is having or could have on your newborn is fraught with a lot of emotion as well.
Well, absolutely. And this is why we should firstly try and stick to the facts, things we actually know, rather than things that might be true and might be proven in 50 years to be true. So we'll stick to the facts. But also, we have to confine our decision-making process, I think, to the best decision we can make today, not the decision we might feel bad about in 10 years.
Yeah.
We're called upon in life sometimes to make decisions relatively quickly based on the best evidence that we had at the time. And it's not really fair or useful to beat yourself up about that if that later turns out to be unwise, but you didn't know that outcome in advance.
Yeah. Live in the now.
Well, that's right.
Yeah. Oh, well, there we go, Pat. I want to leave it there. That's such a good thing. Just make the decision.
Be kind to ourselves.
Yeah, be kind to ourselves. And once you've made the decision, just love the decision you've made.
Yes.
Yes.
Yeah, absolutely. No, absolutely. And there's a lot of second guessing that goes on.
Yeah.
Love the decision you've made and talk about it like it was a decision that was right for you in your circumstances.
Yeah. Good. All right, everyone. That's the end of the podcast and episode, and we hope that you've had a really in-depth discussion, heard an in-depth discussion about the pros and cons of vaginal and caesarean birth. And until then, right now, we've got to move on to
Myth or Fact.
All right, Dr. Pat, this is still about cesarean section. So once you've had your baby and you're recovering, do you bleed less after a cesarean section compared to a vaginal birth?
Oh, you don't mean at the time of
Not
the
at the
birth.
time
You
of the
mean
birth.
during the recovery?
Yeah.
It's about the same.
It's about the same.
Yeah.
Yeah.
So what we do, the bleeding that you get from in the up to 6 weeks afterwards, is just bleeding from the uterus, and it's often fairly steady and gets a bit irritating, and then it tends to disappear about a week before we see people at the 6-week check, and they say, "Yep, it's just gone," and it's coming from the inside the uterus itself. And what we do at a cesarean section, even if the cervix is closed, is coming down from above. You can often put your finger in the cervix from above and give it a little stretch, and just make sure that there's some way of that blood getting down the cervix and out the vagina. So the uterus doesn't know whether the baby came out vaginally or through a surgical incision, and the bleeding's about the same.
Yeah, wow. My first cesarean, I was shocked with this. I thought because you're in there with your little sucker that you'd sucked up all the blood.
What?
I was really surprised I was bleeding.
Well, we suck up the blood that's there that day.
Yeah, yeah.
But not all the blood that comes all the other days.
Yeah.
Yeah.
Good.
Not the future blood.
Not the future blood.
Yeah.
All right.
Good. Well done.
Good. Thank you, Pat, and thank you everyone for listening. We enjoy these podcasts so much, and we enjoy just it's about the main time you and I get to sit in the same room together, Pat, isn't it?
In this little room.
Yeah.
No, it's fantastic. We're having a lot of fun with it, and thank you for listening.
Yeah, and if you love our podcast, please rate us 5 stars, share it with a friend. I know we're wrapping up, but I've got a really funny story about someone who was a air hostess, flight attendant, and they ground the flight attendants at a certain time, and they put them all into the same room as every other pregnant woman, and she'd listen to the Kick Pregnancy podcast, and she'd go to work and she'd tell all the pregnant women all of what she'd learned in the Kick Pregnancy podcast.
Good.
How fantastic is that?
Excellent. Tell your friends.
Good. All right, everyone. Have a great week. We'll see you next week.
Bye-bye.
Bye now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.